Welcome to the Studio Talk podcast. I'm Xiomara Sosa, your co-host. Every week, we speak to our community members to teach them about mental health through education and awareness, and our hope is to inspire them through social change advocacy. We also interview community members and other mental health professionals, clinicians, healers, students, and wellness professionals. Our style is storytelling. Everyone has a mental health story to tell. The information shared in this podcast is not a substitute for seeking help from a licensed mental health professional and is not a substitute for psychological diagnosis or treatment. It's purely educational and purely social change advocacy. If you find yourself in any sort of mental health emergency or distress, please dial 911 or go to your nearest emergency room. Hi everyone, welcome to the X podcast, Real Conversations about Mental Health. I am clinical mental health counselor Xiomara A. Sosa. I am a holistic integrative women's mental health therapist, a private practice owner, a licensed professional counselor and licensed professional counselor supervisor candidate. That's a lot to say, and also a national certified counselor. There's a reason why I'm starting out my podcast with all of that, and I'll explain later. I'm also here with JRoc. JRoc is our technical supervisor and now a co-host every week.
Hey!
Welcome, JRoc.
Welcome.
And then we have, of course, our guest Ant, which he will talk a little bit later about himself. Hi. Anyway, so JRoc is, as I mentioned, our technical supervisor, our co-host, a radio on-air personality here in Charleston, South Carolina. He's also the creator, correct, and host of the award-winning podcast, The Comic Section. Yes.
There you go.
And that's all here in Charleston. Then Lisa is our co-host, who we always mention, and she's been off being busy.
Hi.
She is a trauma-focused cognitive behavioral therapist, which is a really fancy word to say that she helps people with trauma, so she knows what she's talking about. She's also a private practice owner. She's also a licensed professional counselor in South Carolina and a licensed clinical mental health counselor in North Carolina. And Lisa is also a national certified counselor, right, Lisa?
I am. That's a lot to say.
That's a lot, right? That's a lot to say. And there's a reason why all of that needs to be mentioned, and I'll explain that later. So Lisa and I are both mental health clinicians, just to make that clear. Anyone who's a mental health professional, regardless of the title that they're using, psychologist, psychiatrist, clinical social worker, psychiatric nurse, because there's a bunch of new ones now, right?
Yeah.
They're all considered mental health clinicians, therapists, and counselors, all the same. So when you hear us using those terms, it's all the same. The difference is some of us come from a wellness model, some of us come from an illness medical model, some of us have both. Like me, I integrate them. And some of us have PhDs and medical degrees, so we can prescribe, we can do research, we can do extensive assessments. Those are the psychologists and psychiatrists, and then the rest of us. But we all have to be credentialed to do what we do, and we pretty much all speak the same language, and we're all like sisters and brothers in the same thing. We fight among ourselves, but don't mess with one of us, because then we'll come after you. Okay, so
Amen.
So yeah, so we all have the same language. So Ant is going to say a little bit about themselves, right? Because pronouns.
Hi. I'm 33 years old. I like long walks on the beach.
So is this a dating show
Ladies, if you're out there. Well, my name's Anthony. I'm 33 years old. Friends with this goober right here, JRoc.
Hey.
But he's cool. He got me on the podcast. So one of the reasons why I'm glad I leave the house.
Yeah.
Because of this fool right here.
There you go.
So we're cool.
And we should mention that they are also a co-host on the Comic Section podcast.
The award-winning.
Yeah.
Number
The
5 in
award-winning.
Charleston. Hold on.
really award-winning?
It is.
Yeah, it is. Yeah,
Yep.
it's pretty
awesome.
cool.
Yeah, thank you.
That's awesome.
So there's that. All right, so now that we're done with all that stuff, today's topic, what are we? Episode number 28. Today's topic is men and mental health. Okay, so I do women's mental health. And when I say I do women's mental health, I do feminine, women-identified people, I do transgender, I do cisgender, I do women veterans, Latinas. It's just anyone who identifies within that realm is who I do. Lesbians, gay men who have an identity with femininity, all of it. And there's a reason why I do that, and it's mostly the cultural competency piece of what it requires. That's sort of my area, I think my little specialty or whatever it's considered. Men, that doesn't mean I don't see men. I don't help men. I don't have men clients. I do, and I used to have many more than I do now. This is my niche now. But I haven't been really, that's not necessarily where I've been focusing on lately. Lisa, on the other hand, does, and in particular, she does couples. So the whole dynamics of couples, she and I have had.
Just saying the word.
Yeah, it's just, it's that should be a specialty, in my opinion. Like,
I agree.
That really should be like a specialty because it encompasses more than, because your client is the couple, but really not really. It's like you have two clients at one time.
It's like you have 3 clients.
Yeah, that's true, because then you have the family.
You got the husband, wife, and then the couple.
Right, yeah. It's very, and look, and it's not anything to joke about because it's hard to go get help when you're a couple, and then it's not above getting to where there are screaming matches that go on. There's stuff that happens that we have to be trained and equipped to do, and the whole issue for us is that we can't take sides, and we have to make sure, and sometimes you have to, because if you have a narcissistic personality disorder coming in with someone who's just being abused by it, and then you can literally be putting the other person in danger doing the wrong thing with the guy or the girl who is the problematic, and they're using therapy as a weapon. So it's very complicated, and kudos to Lisa for that. Okay.
Yeah.
All right, so moving on. So one of the things I want to make sure that we talk about tonight with the men and mental health, and we might have to do 2 parts on this, we'll see. People who identify as men often face challenges due to the norms and expectations around masculinity. That's sort of obvious, and the research is there, the science is there. So I'm going to repeat that. People who identify as men, whether they are assigned male at birth, whether they identify as men, whether they identify as non-binary and include both, the challenges are there because of the perception of masculinity, the perception of you're the man, the perception of what your norms are, the whole conditioning and everything that goes around that, right? So the expectations around that is important to sort of take note about, right? So because of the way people expect them to express themselves, it's been found that this makes it harder for men. And when I say men, I'm talking about all of those groups that I just mentioned, okay? I just don't want to say all of those pronouns every time I speak, so, okay? It makes it less easy for them to go get help for a lot of reasons. It's important to remember that gender isn't binary. I don't want any pushback on that. If that's something you want us to do a show about at some point so that we can clarify and it become the issue, it'll become the issue. But those of us in this room understand what that means, and we accept it, and some of us are still working to understand it more. So this is a no judgment zone. So people who identify as men, regardless if they're assigned sex at birth, really, a lot of the times they face challenges due to these norms and expectations. What does that mean? What does that mean, Lisa? What do you think?
The challenges that they face?
Yeah.
Oh, my gosh.
Well, we can talk about expressing themselves first, right? What's the deal with that?
Well, the first thing that comes to mind is in the workplace.
Yeah.
Because if you're feeling like you have to fit in, you have to adjust to what the majority of the people around you are expecting you, how they're expecting you to talk, walk, the things they're expecting you to say.
Yeah.
So everybody kind of has their work persona.
Yeah.
This is them having to take on an additional persona.
Yeah.
Just so they can get through the day.
Yeah.
So I see that a lot.
You see that a lot?
Yeah.
And, it's interesting because there's that, and then that doesn't even incorporate the cultural piece. So if they're African American, if they're Latino, if they're recent immigrant, if they're third generation, if they're Native American, if they're Gullah Geechee, we don't know. Whatever it is that their particular personal cultural experiences also contributes to the fact that then there's still the masculine presenting stuff that needs to happen.
Yeah.
So Lisa and I obviously don't experience that. We experience the women's stuff that we deal with all the time. So we can't really speak of it in terms of lived experience. So we're gonna talk with you guys about this and see.
All right.
Yeah. So what do you guys think about that?
Pressure's on, right?
Yeah.
No, I agree. Definitely, just based on how I was raised. The men in my family, so from my father's side, mother's side, they always had that, hey, okay, we ain't crying, what I'm saying? You're just going to go out there. You got to just go
Suck
do
it
work.
up.
You got to suck it up, man up. That was always something that I've heard, for the long.
Everybody's heard that.
Yep. So, and then just some of the, like you were mentioning, like the communities, right? So I know with me being black and like that like that that stigma of the black household and the black man. And it's like, look, hey, you a black man? Okay, number one, when you come home, there's certain things you need to do. You have to make sure you take care of. Number two, when you leave the house, because of where we live in America, that's another added pressure as well. Like, okay, you a black man in America, you got to know how to move and know how to operate. You can't do certain things, but also you're still a man at the end of the day. So,
And as a caveat, I do want to interject one thing, because I am from the North originally, and the reality of being a black person in the North, where I grew up around, not that it did not come with it. It came also with its challenges. But being in the South, it's an entirely different world. What I see is the deal here. Yeah. And you don't even have to be like the average black guy, fifth generation South guy. You can be like the first generation black guy who came from, I don't know, the Caribbean or something.
No, yeah.
And it's still a different experience.
It's a different experience.
So I just want to make sure that gets put out there, because that's just another layer.
Right, for sure. So yeah, no, that I mean, some of the men in my family is military, so like Marine, Army, so that also is another layer. Like, okay, no, you're gonna get up early, you're gonna go do all of this, and the sensitivity. Like not too many I love yous from the men in my family.
Really?
But
so do you think that speaks to what I said earlier about your ability to express? Because what we just said carries with it a lot of fucking pressure and a lot of feelings and a lot of things. So if you're not allowed to express those things because of what you just described, where does that go? Like, where does that go? What happens then?
Keep it inside.
Yeah.
Bottle it in.
And what do we learn about that?
It's not good. It's not good. It'll come out eventually.
Yeah. So do you guys see that amongst your peers, whether they're first generation, next generation, current generation? Do you see the effects of not having been modeled, people not having modeled appropriate ways to express yourself? Like, what's that like?
It's it's wild. Like, piggyback off JRoc, my mom and my dad were they were tough. You know, stop crying, I'll give you something to cry about. Things like that. Not to be funny, but this happened at work. This was last year, where the Barbie movie came out.
Yeah.
I was like, oh yeah, I'm seeing that this weekend. They're like,
what? Why are you gonna go see the lady in the pink dress?
Right. I was like, because it looked cool, and I think it'd be fun. I shouldn't have said nothing.
Can we support Ken?
Like, there's dudes in that
Ken's
movie.
in there.
Yeah.
Ken's. So I'm like, oh, okay, I shouldn't have said nothing. So things like that, like I couldn't be myself. For
So
like
what's
a long
the
time.
message in that you hear when that's thrown at you? What's the message you hear?
Well, originally we just shut up and just not say anything.
Yeah. No,
And that's the beauty of therapy,
Yeah.
because I see so many men come in. They come in,
right.
here.
All guarded.
Right.
and then they sit back, and they're able to just let it go.
Right. Yeah.
So
Yeah.
Which I think is important. I mean, I've seen, I'm not above saying, I've seen in my own family. I mean, in my family, of course, again, with the We're Latino and also the Catholicism and also the Caribbeanness and all that, the general, in that generation who immigrated, like my parents' generation, I just happened to luck out and, be in a place growing up where people were diverse and open and all this kind of stuff. And my parents seemed to be forward thinking and progressive generally. But there were certain things that were where they were. And that was, the machismo in Latino families. It's a real thing, okay? Like, it's a real thing. And I have to say that on the Dominican side, and on the Dominican side in the Dominican Republic, it's a lot more accepted, expected, worked with, okay, that they are so machismo about being the dude and whatever. Where I used to have, like my parents, my father had some of that, but he sort of like raised us a little differently, but some of that was still in there and it showed up with my brothers. But I wouldn't say that it was perpetuated and it was like modeled and all that. But when I would go to the Dominican Republic, or like our uncles and cousins would come from there, it was a clear
battle with me. Like, I was always the Dominican cousin that was like, not the troublemaker, but oh God, like it's her.
You get too much to say.
Yeah. Like, what do you mean? What do you mean no? Or why would you be talking when the men are all talking? Or this is not the way we do it. Or that's not how we, like, it was just very traditional and very machismo and what it meant if you behave. And I was incredibly verbal about it, like vocal about it, like, no, I'm sorry, no, that's disrespectful, and that's from a young age. And my parents never discouraged me about that, but it wasn't until I got in the mix out there that I recognized, oh. So at first, I don't honestly think that I responded correctly to it, but I did respond. But then as I grew up and I understood the value of culture and I understand how to align things that may not work for us here or for me here, when I'm around them, it's not that I'm okaying it for me, but I think that there's a line where you have to say, this is their culture. As long as I don't see abuse and like outright violence, who am I to judge? If it's working for them and this is how it's working, I learned to make that peace with it. But what I do recognize with the next generation, which would be like my brothers and my cousins of that age, is that there was a lot of mixed messages for them as men and as men of color and bicultural men and bilingual men. Like you get to be, Latinas do this, they are very mushy-gooey with their guys at the house, right? Kisses and love and babying and all that stuff. And then they have to go out and not be that, right? They have to not, you can't be giving them 20 kisses on their cheeks when you drop them off at school, which is what we do. We'll smooch you up until you like, like we're smooching you the entire way to school. So my brothers, they were raised with that sort of home expressive, demonstrative. We are a demonstrative. Puerto Ricans and Dominicans are incredibly demonstrative and handsy and lovey and dovey, right? And so they grew up around that, but then they had to sort of assimilate to what they were expected to be here. And it showed up. It showed up, like that confusion, that incongruency eventually showed up. Have you guys ever experienced anything like that? Like, or is it just one consistent message for you?
I think with me, I don't know. It's kind of similar in a way. I feel like a lot of times too, like you were saying, of Catholicism, like obviously with me being raised in the South, like my mom was like the heavy church girl. She still is. So when I was young, like my dad would stay home. But like he would all be like, "You go with your mom to church. Don't start nothing. Go where."
Like my house.
Really?
My dad said, "I will drive you all there, but I will not.
I'm not going in. I'm like,
my
hold
dad
up.
said, I will stay in the car. Go with your mother."
Yeah. Yep, exactly.
Oh, really?
Oh, yeah.
That's interesting. Yeah.
Yeah.
He was like, "I'm not doing that church stuff."
Right. And my dad, and here's the crazy thing is my dad grew up in the church, so his whole excuse is, "I did my time."
Yeah.
Okay, our dads might know each other. This is ridiculous.
I'm telling you,
We might be related.
It might be. It's like I did my time.
I'm grown now.
I'm
You go
good.
ahead.
Y'all go.
I can decide now, and I'm choosing not to do that.
Yeah. So I'm like, I'm
interesting.
telling my mom, and then my dad's like, "Well, why can't he go?" It's like,
He's
well,
grown.
He
Well,
He grown.
Yeah. But like with that, the church experience, and like even hearing the pastor would preach certain things in the Bible about, because you in the Bible, women don't really have it the best in the Bible.
Do we exist in the Bible?
I mean, it's like
Jezebel, maybe.
and then Eve. It's just like with just that experience too. Like, okay, all right. So if you're the man in the house, you got God, and you got you, and you got your woman behind you, and you as a man, and you got to do this. You got to lead the house. So. So experiencing that, it was kind of like, okay, and I'm young, so if I'm like a kid that's like 9, 10, still trying to find myself, I got a lot of responsibility now. I thought, so that type of pressure I felt real young.
And I do think that it eventually shows up. I think that one of the ways that I know that fewer than half the men who have signs of anxiety and depression, whether it's clinical or situational, irrelevant to me. The symptoms are sort of just there, right? Yeah. Only half seek treatment from a mental health professional. And men are likelier than women to use illegal drugs, overdose, and substances and visit the emergency room due to drugs as self-medicating. Not even because, hey man, let's go party. It's like self-medication to deal with whatever those things are that all of this. And I want to make it clear that we're not trying to say your household turns you into a drug addict or makes you a mental illness person. That's not what we're saying. What we're saying is the tools that are needed in life to manage the things when you feel these issues come up, like anxiety and depression. If you are in a culture or in a situation that does not make it safe and sends the message that you can express yourself, you can tell me that you have depression, that is when these statistics start to show up. See what I'm saying?
Mm-hmm.
So I just want to make it clear, because you'll have somebody inevitably sending me a message. It sounded like you were saying that I'm going to turn my kid into No, I'm not saying that. So, and then this one I think is a big one. The suicide rate for men is about 4 times higher than women. And with men over 65 having the highest overall rate.
Yeah.
That is something. And I'll have all of the references to these statistics and to these, because this is all evidence-based. I'm not making it up. So I'm not going to mention each and every research and study and where the statistics come. It'll be in the show notes. So that's one for us to ponder, right?
Yeah.
The other one is on a positive shift. For example, when the COVID pandemic hit, more men started engaging with mental health care, that we've ever seen before. Like, what's that?
I really attribute that to virtual.
Yeah.
Yeah. Because
Oh, wow. Yeah.
because if you can seek help
Yeah.
from the privacy of your home.
Yeah. Yeah. And it's almost like this anonymity that.
Absolutely.
know-
Absolutely. It's just too easy to log in.
Yeah.
And talk to somebody, and then an hour later or 50 minutes later, you're done.
Well, that
No one
was.
has seen you drive over there.
Yeah.
You didn't have none of that. So
Yeah.
I really
And you make your appointment online and it's sort of
Absolutely.
private and all that. So did you guys within your peers notice anything like that, like a positive shift after COVID-19 pandemic, that maybe the people who identify as men were starting to embrace mental health a little bit more, or mental health care a little bit more?
I think COVID was like the first time I went to therapy
Oh, wow.
for the first time, because I was like, hey, either I do this or I'm going to end my life.
Oh, wow.
It was that bad. So
It was that bad.
Yeah, so I went to this, I forgot where it was at, somewhere in West Ashley. And it was cool. I was medicated for a bit, but I ended up getting a new job, so I couldn't go.
Yeah.
I ended up working at the post office.
Yeah.
That sucked.
Yeah.
But
Yeah, maybe one of our episodes will be like access to mental health care.
I
and the
thought you were
work
going
and
to say
all
working at the post office.
don't do it.
Advice
2
for
minute
working
episode.
at the post office.
Yeah. But that happened, and I kind of slipped back into my depressive episodes to a point a year before last at my current job now, which they actually have therapy through our insurance, and it's over the phone.
Yeah, good.
So it got to the point where, not to get all morbid and dark, where I didn't go to work for like a week,
Yeah. Well,
And
those
I
are
would-
signs and symptoms.
and I was sending like red flag messages. I'm like, hey,
Yeah.
it's been nice knowing you.
Yeah.
And following with me, even my boss was like, hey man, here you go.
Yeah.
Because even he saw it.
So are you feeling like you've gotten the support and the help, or at least a door's opening for you to go in that direction?
Yeah, the door's open. I still have my days where I'm like, God, this sucks.
Yeah.
But knowing that I can just call and be like, hey, need
Yeah.
an appointment, just over the phone, 45 minutes, maybe 50.
Yeah.
That'll be it.
Yeah.
That's fine.
Yeah. And I think I like what you're saying, because one of the things that I like about this shift, particularly with men, right? It's like this stigma, this incorrect visual idea of what it means to go to therapy. So first of all, you have to be so mentally ill to go to therapy, which is like the stupidest.
Or you must be crazy.
Or you must be crazy,
Yeah.
or you're weak, or you don't need it. They're just saying you need it because they want you to, like, all of these stupid things. That's not what therapy is. Therapy, you do not need to have a mental illness. You do not need to have some current crisis. In fact, what Lisa and I are huge what the clinical counselors advocate for now, which wasn't advocated before we came on the scene so much, is that prevention, intervention. We don't just do treatment, because before that's all it was. It was like treatment. We're going to wait until you become suicidal.
Yeah.
You're in a major depressive episode. Your anxiety's out the roof, where your job is in jeopardy. You almost killed that guy at work or something. Then you go, and then you get fired, and then you hurt, and there's all these repercussions from it. That's not what therapy's supposed to be for. It's almost like when people use the emergency room for primary care. That's how I look at it, right? Like, that's ridiculous. So what clinical counselors sort of like, our whole thing is, everybody has to go through something. Everybody has maladaptive ways of coping with things. Everybody has some sort of mental health condition that came up because either it's biological, because of the socioeconomic status, because of their, history, culturally, whatever the reason is, or maybe you just went through a bad goddamn breakup. Like, we don't know, whatever it is, right? So therapists are there to prevent you from ever having to be a necessary evil for you. That is what a therapist does. So it's sort of like going to your primary care doctor once a year and getting your blood checked and getting your heart checked and getting everything checked, so that if something shows up, if there's like for me, I had skin cancer in my face over here, and I would have never known because I'm not a sunbather person. Like, I'm not that person. And then there's the stereotype that Latinas don't get that, right? Big lie.
Yeah.
So I came here and I went for my checkup, and they found that, and I went, and like, I had to have the Mohs surgery and all that. And one of the things that I learned from that is this is just such a great example of why people need to check in with their mental health person. Because if I hadn't checked in with I didn't have any reason to go.
Yeah.
Other than hey, I'm getting screened. And I went and I got screened, and the next thing you know, Alexia's taking me to go have surgery in my face because I have skin cancer, and this is not good, but they caught it, they intervened, I did my treatment, I'm off into the world taking care. Now I know how to not get cancer in my face, how to avoid it, how to not go down that road, so, and mental health is a lot like that. And like I said, people like Lisa and I, our big, huge message is, why do people think that you have to be in a crisis and there has to be this huge mental, persistent, you have to have schizophrenia to come? No.
Well, for men, another obstacle I have heard is that there are not a lot of other men that they can go to.
Men in their lives or men in the mental health field?
Men in the mental health field.
They're not wrong. I have often wondered, one of the reasons why my practice is so successful and it's so beloved by the people that come here is the first thing I ask, because you do the intake and then you ask, how'd you find us and why'd you choose us? It is the first time that it was women's only, and all women's. They really like that all women, but women's only. I've never seen that before. I've never, and also that it feels like an art studio in here, and as opposed to a clinical setting, something's wrong with you and you're gonna be diagnosed all the time and all that. And for men, I talk about this all the time with Seal. I wish to God that there was a men's version of what I do, so that I can refer.
Yes.
Lisa and I are kind of doing that now in a way.
Yeah.
I get the wives that come in, or the partners, the female partners, and then their issues.
The men to me.
Yeah. So I have one current client who's dealing with extreme anxiety, and it's based on her husband's a former Marine with PTSD, and he had a great therapist who's no longer here, and so now he's sort of slipping, and he's noticing that he needs that every week thing, but he can't find that right person. So I referred him to Lisa, which to Lisa and I is really great, because then we get to consult about the cases where it's mutually beneficial for each client, but they each have their own person, right? But if you were the guy version of me, it would be what you're talking about.
Right.
Yeah.
And men of color. I
color.
hear that a lot, because I will have a couple that, we're doing couples counseling, and it's clear that the man needs his own therapist, and he'll tell me, well, you can give me a referral. However, they need to look like me, or I'm not going. Yeah. Okay, so now my list is 3.
Yeah.
And they've got a wait list.
And they have a wait list, and it's sad.
Yeah.
It's kind of like
so
the
that
Latino
is another big issue. I don't know if.
No, yeah, and I mean, we talked about it a few times off mic. I've never been to therapy. I'm open to it because, looking at patterns and stuff, I'm oh man, I might be. I see signs and stuff.
Something ain't right.
Yeah, but
he said something ain't right.
So, but no, I would say all the time, I feel with me, it's my barber.
Yeah.
That's the barber.
What?
The barber is so many things to the community, and it's I go there, get a cut, and we just discuss. It could be anything, and that's kind of
that is true.
Doesn't that go back where we originally started at? at the barber, you have an explicit permission. It is understood that you're allowed to express yourself.
Right.
That is where you express yourself.
Yeah.
That is where you get to
And they got
process.
the coolest stories at the bar.
That's what I'm saying. It's like
Swear to God.
everybody's story. It's like, oh man, you went through that. Like, yeah, you know, and you get like some gems that they would drop, especially like the older gentlemen that's in there, and they'll talk to the young people like, hey, young blood,
Yeah,
y'all better watch out,
Don't
y'all,
go down that road,
you know.
young blood.
So it's like,
I've been
oh,
down.
okay, all right.
So do you feel like that's like we have an area in mental health that's called community mental health, right? And it almost sounds like that's sort of a little bit like that, but better, right? Like they're not agency kind of.
Yeah.
But community mental health is a tough place for us to work because
But that's really a cultural.
it's a culture.
Yeah, it really is.
Yeah.
And it sounds like what you guys get by it is the closest, because there's this thing called counseling and this thing called therapy, and they're sort of the same thing, but one is much more specific and time specific and focused on the thing, and there's specific techniques, and then there's counseling. And counseling it's a lot more about what's going on with you right now. What are we doing? What's happening? What do you need? Let me get you through what you're going through. And it's still very therapeutic, but it's short term. It's basically like I'm fighting with my sister a lot and I can't figure it out. I lost my best friend cousin and it's really getting to me. I need to talk this out with someone. So it feels like when you guys go there on a community level, not only do you have the permission to open up, express, and tell your stories, you get validation.
Right? It's not therapy.
It's not
They're not
therapy.
doing therapy.
Right.
No.
Yeah.
But you get the things that you get out of. It is therapeutic, even though it's not
Therapeutic.
therapy.
Right.
And what makes it therapeutic is that you're getting validated, that you're hearing stories and you're being listened to, that you are also in fellowship, it sounds like. Like you have mentors.
Probably the
Yeah.
biggest thing. Yeah.
And
Yeah.
and to top it off, it's like it's that dopamine hit, because
Yeah.
like when you express all of that and you leave and you look good, you're like, oh,
yeah.
my God.
You got that fade.
Oh
Yeah,
my
yeah.
You got
gosh.
that fade going
You
on.
can't
looking
tell us
sharp.
nothing.
Can't
We in
tell
the
me
car.
nothing.
We are on
Window
cloud
down.
nine. That's it.
You guys should know that Lisa's husband,
I knew you were going to say that.
Lisa's husband, I'm not going to say his name just in case he doesn't want me to, so if you want to, is a professional barber with his license and that he's working
That's why
on.
when you mentioned that, I was like, yep, that is true.
And he used to work upstairs when I had my office up there in Lisa.
Oh, that was him?
That was him.
Oh.
Really?
Patrick works up there, and then he used to work.
He worked in there.
Yeah,
It's
he worked.
they're probably thinking.
Yeah, he's
Patrick.
not Patrick. Patrick is the owner.
Okay,
and then
okay,
he
okay,
worked there.
Okay.
Okay.
I was,
That's who I was
that's
thinking
who I was
about.
thinking. Yeah.
Patrick is the owner, but
Okay.
yeah.
Yeah.
And so anyway, so we're laughing at that because we're like, oh,
But no, but 'cause
Get
I was
that
like,
look.
I know that. Yeah, it's true. I know that.
yeah.
That old high
And it's
top
important.
fade.
Yeah.
And then let's talk about it from your husband's perspective. Like we've talked about it between us, how he doesn't need it. This guy's retired Air Force, and now he's a GS something teen over at the base. And he was his own little barber guy, and he's getting his license, but he always misses coming back to that. Why, Lisa?
It's therapeutic.
Yeah.
He likes talking, engaging, and then cutting hair.
And looking good.
And then because he's like, I did a good haircut.
Yeah.
They look clean. They like it.
They put that mirror in front of your face. Like,
Yeah.
oh, look over.
Just as good as you feel after that, that's
Yeah.
how good he feels.
Yeah.
That's awesome. Yeah.
So see, I think it's all relative.
That's why when you said, I was like, yeah, that is
Yeah.
true. Yeah. He says that. I'm like, why are you
do you
cutting
think
more hair?
that for him, do you think that it's also he not only does he give something to his clients, but he gets something from them?
Absolutely. Because he still does it. Like he was there the other day.
Yeah, just his one little
Yeah, he
client.
was like, I'm going to go in there and cut some hair. I was like, okay.
Yeah. These are the kinds of things, and we'll always bring everything back to mental health, right? And these are the kind of, what we just said, what we just talked about in the last 5 minutes is a classic example of self-care. This is what we would say to men coming in who are feeling some kind of way. Like, what are you doing for yourself in your life that is self-care? And I don't mean that in the way that they're talking about it on the internet right now. Like we're talking about like real internal self-care. Like how does this make you bring meaning to you? How does this make you feel that you're aligned with your goals, with your belief system, do your people that you're hanging out with reflect who you are? Or is it incongruent and therefore creating some kind of negative thing in your world and you're in denial of it? Like these are all examples of what we would say, if you love if you love going to the barbershop, and that's the place where you get your peace. And that's the
Yeah.
place where you can work some shit
That's
out.
that key word, peace.
You get your peace. You can trust it. It's safe. It's therapeutic. You don't need to go see a therapist. But if you're doing that regularly and you got your boys and your guys and your elders guiding you the right way, saying, man, I'm sorry, I know you love that woman, but hey, look at the history in the last year of what's going on with you.
Try to warn you, young blood.
Yeah.
That's how I mean.
Warn you, young blood.
Yeah. You know, like,
You gotta throw in the young blood.
yeah. Like you got those people saying you're with this person, and since you've been with this person, you've lost your family, you've lost your job, you've lost your this, you've lost your money. Like, what's going on? You got to look at that, young blood.
Yeah, there you go. See him right there.
You know,
young blood.
like that's what we would tell you
Right.
to do. Like, why aren't you doing that? What are you doing instead? Are you isolating at home? Are you hanging out with other negative people who only, do negative things?
Right.
Are you self-medicating? How are you self-medicating?
Yeah.
I think men self-medicate a little, other than what we talked about, but there's a lot of like I feel there's a lot of violent related ways that they work these things out. I'm not saying they beat up on people, but like maybe a violent movie might work. I don't know. Or maybe fighting with somebody. Video games. So it's not like they're going to the spa like women go and get a massage or whatever. And I'm telling you, that would be helpful to get a massage. Get those muscles worked out, because so much of your tension and stress gets stored in there and you don't even know that it's in there. And go get a male massage therapist, because they know and they're talking about. Like, those are the kind of things that we would help you figure out. You know what I mean?
Yeah, I got you.
But if you're dealing with, like Aunt mentioned, and we heard you, that you struggle with some dark times, right? And we're all here to support you, and we're always here to make sure that if you need some kind of help or some sort of something, we're here. But there's no shame in it, right? Because we all have these things that come up in these moments and these times, and we're not above it.
Yeah, I think that's the big thing. A lot of men would feel shame that they had to seek help.
Yeah.
I did for like a small portion. I did.
Yeah.
Yeah.
Does that come from an external thing, or is that like just an internal message you give yourself?
A little bit of both. I don't know if you went through this when you're a young blood, but but like
Tina Marie comes to mind for some reason with this song she had called Young Blood. Young Blood to the party, like something like that.
R.I.P. T. Marie. But I don't know if you went through this, but when I was younger, we can talk about mental health being in a black household, because I've heard this plenty of times. That's that white people nonsense.
Yeah.
Yes.
That's
Yeah.
it.
Yes.
Yeah. Oh my God.
And
Yeah.
take- For a
You and your
while.
depression, go wash them dishes.
Yeah.
clean the room.
Yeah. That's
Yeah.
it. Yeah. That's it.
Yeah.
You hit it on the head. Oh my God.
Plenty of times. So
So you guys didn't have the chancla. You
No. We
No, it's like whatever you're saying your trauma is, they're gonna take that and go
work.
Yeah.
take the trash out.
Take
I
trash
cared you
out.
for 9 months, and this is how you.
There you
act?
go. Yep.
Yeah.
The 9 month. Oh my gosh, man. That's my childhood right there. That really is.
You ain't grateful for nothing. You depressed? What that mean?
Yeah.
Well, depress yourself over to
Depressed so behind back in that room.
What's all about? Keep these lights on.
I know my parents aren't listening. They didn't do that to me. I heard it.
How you depressed? You got a roof over your
Yeah,
head.
you got a roof
clean
over your
clothes.
head, clothes. What you got?
we got that too. Like I think it's just a very ethnic thing, because it's a survive. We had survived. Like our family, literally, my father came from another country, fleeing a dictator and trying to not have his babies over there so that we can have a good life for ourselves, right? So his idea is, hey man, that shit's over. I brought you here. Now you got all the time in the world to go do your thing. Let me carry that burden.
Everything's perfect now.
Yeah, everything's perfect now. But then we learned that that's not true, because there's a whole intergenerational trauma stuff and how that all works out. And like for each ethnic community is different, because like for the Native community is different how their intergenerational trauma plays out and shows up and all of that. And then for the African Americans, obviously, because their history is different and it's intergenerational depending whether you're in the South and North and what all of that. And then those of us that have the Caribbean background, it's a different thing. But when you all, at the end of the day, I think that when it has to do with mental health and men, we do need to be, first of all, talk about it. We need to talk about it with our guys. We need to talk. I used to talk about it all the time with my brothers. Like, honestly, like with my brothers, I would, in my youngest one in particular was very open to it once upon a time. And he was very, 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 like, he was going through divorce. Oh, no, we're all going. The whole family went. We support it. And the counselors, I remember the therapist looking at us like, oh, well, who's the client? We all are. We're all here together. We're all here. The children are going through a divorce. We are here to, and then all of us would have all of that. And then we get our individual ones. And he was open to that, but I don't think he would have. I don't know. I can't speak for him. It's his story. I don't know. But my memory of it is that if I suggested it, if I recommended it, the message was, it's okay, it's cool, don't worry, I'm here for you and whatever. And then it wasn't like a fight. It wasn't pushback. It was okay. It worked. It helped and whatever, whenever he needed it. There was never like that stigma. But as a police officer, it's a whole different story. Like you can't and you did.
And then that's a segue into your career.
Your career
Dictation too for men.
Like that was a problem. And I didn't know how to manage that as well for him. But so they had to go outside of the work and not let people, that kind of thing, know. And which that's a whole nother thing. But I think that it's important for us to have, as women in particular, to be able to make it, to normalize it and okay. Like, your tooth hurts, we need to go to the dentist. Are you having anxiety? Because, with them it shows up differently, right? I know that with my one brother, it shows up, this hacking thing starts and like anxiety and, like nauseous and like there's signs that come up where, there's a lot of stress, there's a lot of whatever. Right. And so you want to say something and like, let's go, or there's relationship or family stuff and you recommend it. But then, segue, right? Be careful who you surround yourself with, right? Because at some point, there will be people who don't be that. Well, they're not going to be about that. And then it'll change the narrative on why you're telling them and suggesting maybe we should go to therapy. Yeah. Maybe like it changes what the perception of why you want them to go, or why you want to go, or why you think they should go. It changes it and it turns adversarial, which in my case it did. And at a point you have to say, well, that was not like that before. Why is this a problem now? And why am I being looked at that way? Okay, then, there's not much you can do about it because you got to leave it. You have to leave that door open for them to recognize that even if you don't go because of what's going on now, you deserve to go talk to somebody about all these stressors and shit that you've been through, men in particular. Yeah. With the jobs that you have, and if you're of color, and then you're the South, and your family issues, like, you deserve to go talk to an unbiased individual who has zero to do with any of this, and you can sit there and tell them your story, and you figure out how much of this was your fault, their fault, our fault. What do we do? It ruptured, we repair, my anxiety. Because what it shows up like in men, and I can only speak for the men around me, right? I know that I would see a lot of excessive cleaning, excessive working, very high-strung sort of ways that we manage the work-related stress, the family-related stress, the financial, like it was all, and it's not that it didn't work or there's something innately wrong with that, but it's a self-medicating, sort of coping mechanism that isn't going to always work and doesn't take away the underlying thing that has happened, that's been going on, that lifelong, we all have lifelong shit that we have to deal with. And what do you guys think about that? Like having people around you to either encourage or discourage it, who bring it down, make you feel some kind of way about it? Like, does that play a role in any of this?
Well, that's why I was kind of thinking about what you were talking about. How were you able to do what you needed to do? Because what you described is not really having anybody kind of like supporting.
Like my mom said, like, that's the white people nonsense.
Yeah.
I surround myself with white people who will listen.
Yeah.
I'm like, all right.
Interesting.
I was like, all right.
Yeah.
Since you said it's white people nonsense, let me find some white people.
Mm-hmm. And talk to them about that. So the one thing I will say about that, I think that whoever will listen in a way that's in your best interest and not just listen to tell you that you're right or for you to hear what you want to hear or allow you to continue to behave in a way that is maladaptive or self-destructive or destructive to others, you need people who can kind of discern, right? I feel, between those. Because what you don't want is somebody saying, I'll listen, and I think you're right, and you shouldn't. When in reality, that's not in your best. In your case, you feel like you found the right people, and because the white people were the ones listening to you, It's not like you went to any old white people. You went
No.
to ones that were,
Yeah.
yeah.
Yeah, I didn't talk to the janitor at our school. Like, that'd be weird.
Good. And you know, wherever you can get, I think,
No disrespect to janitor.
No, not at all.
or white people. We love our white people. Yeah.
Said-
Because you know someone's going to say something.
What you got?
That's
You got
true.
beef about white people? No.
Somebody's going to say something.
Yeah, that's fair.
No, he said he went to
Yeah.
that.
White.
Yeah.
Yeah.
So there
Yeah,
you go.
we love our white people. Okay.
Gotta love white people.
I mean, we don't like. Yeah, we know what we don't like, but we know,
Exactly.
and we know what it's. Yeah. Okay. That's a different topic.
That's
We got
an
you.
episode.
I got
That's
you.
part 3.
All right. So, how does being a man affect mental health? And here's what the research shows. Right. Each man's mental health is shaped by his unique life circumstances, which we talked about, including genetics, because I think that's a big factor that gets overlooked a lot, family relationships, and experiences within trauma. Trauma is a big one, I feel, because I think boys and men and young men, I don't think they know what we mean in the mental health field when we say trauma, like the little T's and the big T's and the. If it's traumatic for you, it doesn't necessarily mean it's traumatic for me,
Right.
but it was traumatic for you
Right.
because you remember this thing and it shaped you. So by trauma, we mean your personal, unique experiences and how these experiences are now traumas within you that you don't even know are traumas, that you should have a professional person help you work through to even see if you can process it, because it informs how you behave. It informs how you see things. It informs your body. It informs, and Lisa's the trauma person, so I'm going to let her talk about it.
Well, I will strictly speak regarding men.
Yeah.
What I have seen, one of the first questions that I ask is, tell me about the relationship that you have with your mother.
Which is so stereotypical, right?
Yeah.
But it's so necessary.
Yes.
And is your mother present?
Yeah.
And what was that relationship like? Because even if you have the best relationships with parents, it doesn't mean that there's something
Right.
still that you need to process about that relationship. And it doesn't negate that they were good parents.
Absolutely. I mean, and just getting them to talk, because I really focus on using talk therapy, the CBT approach, but
Yeah.
just talk therapy, because specifically with men, they have to be on guard all the time. So for them to be able to just put all that down and just to talk and someone's listening to them without judgment,
Yeah.
that just opens the door. There are sessions where I'm saying, I feel like, have I even spoken? I'm taking, a bunch of notes, but have I really said anything? Because they just need somebody to listen to
Yeah.
them.
Yeah.
Just hear me.
Yeah.
You're not judging me. I mean, I don't know. I know just what I'm seeing in front of me. Men need that. That's what I have seen.
That's what your experience is?
Just me saying that, does that even kind of give you like a, just listen to me.
Well, that goes back to the barbershop thing.
100%.
Yeah.
100%.
Guaranteed.
Yeah. Nah, yeah. It's, because when you bring up parents, it's kind of like with, like, for instance, me and my mom, love my mom to death. But my mom could have her ways sometimes, but it's really, I feel like with me, it's me and my dad. Because I'm the only son, firstborn. And my dad,
the pressure.
yeah, and then my dad had his own business for like almost 30 years, retired, but ever since though, he's always been that, like, all right, like, I'm a tough love.
Yeah.
From him, my uncles, it's always been tough love, no hugs, no,
Oh, wow.
like, none of that. Like, I would hear from other people, like, your dad's proud of you. I'm like, okay.
Yeah. Oh, well,
but
that's nice.
I've never heard him straight
Say
up
it to
say
you.
it to
Yeah.
me. So it's kind of like, I get why I'm like as stoic as I am on certain things. I'm like, oh, okay, I'm like my dad right now.
So, if
So
they,
where do you go to put that down? Like you always have to be stoic. You always have to be
Right.
strong. So where do you set all that down?
Ooh, that's a good question. You know what I do?
you work out a lot.
I do. So the gym really, the gym is that, and I've gotten into like, it's not really meditation, but like I have talks with myself. Like sometimes I will drive, I'll take a long drive, nothing on. I'm like, I don't.
Silence
actually really
is
good.
the best.
I don't
really
listen
good.
to anything. I have the windows down and I just think.
That's great.
And so that's
It is
kind of
really
my go-to. So yeah.
That's good. What about you, Aaron?
As far as me and my mom, like you, love her to death, even though she gets on my last nerve sometimes. I'm like, Mom, I know you were born in 1953, but it's 2024 now. Jesus.
Yeah.
As far as me and my dad, well, he passed in 2005. He was in the military. He was in the Navy. And I didn't know what PTSD was. He may have had it because he drank a lot.
Yeah.
And that's how he died.
Yeah, from the effects of alcoholism.
Yeah, and
that's actually that's what we call comorbid
Okay.
things that go on. So like if they self-medicate and then that becomes the other thing they get diagnosed with because now they're addicted to what they need with that and they still have the PTSD.
So I didn't know what that was. My dad would say I love you, but my mom didn't really do it. And I can remember when the first time I heard my mom say I love you is when I went to boot camp.
Oh, wow.
And that was the first time she said it.
What did that feel like? Let's just do a counseling session.
You were, what, 19, 18?
I was like 22.
Oh, okay.
And she dropped me off at the recruiting office. She was crying. She was like, bye, I love you. I was like, you all right? You good?
You couldn't even really receive that.
I was like, you've never said that to me.
Yeah.
So it's weird. And being adopted and also, I was like, okay, love you too.
So I'm thinking if your father was in the military, he had the trauma, and she was around to witness that, it probably kicked up some of that. Whether she recognized it or not, it kicked up some of that.
Because you might end up like your dad one day.
Yeah, so let me say it to you because maybe that's what we should have said a little bit more to these guys when they came back. I think that one of the things to remember about mental health, and particularly with men, like the physiology, identity, and culture, of course, play a really big role. I also think that PTSD is one of those things that, and I'll say it because it's something that's in my life. Everybody knows I'm a 9/11 survivor, so I had to deal with that trauma. Everybody knows that in my family, my older brother was a Marine, and prison guard, and the other one was a police officer, and all this. So there's all these things, and one of the things that have come up is that before, when this sort of trauma was around, the only thing that we had to sort of not diagnose, but to like think about what language you're going to use to help these people was PTSD, which stands for post-traumatic stress disorder, right? What we've come to know now, what we've learned now, those of us who sort of in our wheelhouse deal with the stressor and trauma-related DSM stuff, is that there is PTSD. PTSD is a very specific kind of trauma-related thing to an incident, but it used to sort of get assigned to every sort of like massive trauma, like the veterans and all that. Now they call it combat PTSD because it is very much about the combat-related PTSD, and that it falls under the same idea of what PTSD is, but you have to you cannot necessarily have a client with combat PTSD and deal with them the same way you would with someone like police officers now have this thing that we're coming to understand is called cumulative PTSD, which presents very differently for them. It doesn't present the way that it does for the combat veterans. And then non-combat veterans have PTSD, and it's different the way that we deal with them, and it shows up and it presents. So that is a common thing. And then with childhood trauma individuals, that's the lot of what I get with women. Childhood abuse, sexual molestation, all of these things that happen particularly with the girls. And then they grow up, and then they have the history and everything, and then they're getting the title, the diagnosis PTSD, and then I come and I do my thing with them. Really what they have is CPTSD, which is not part of the DSM right now. CPTSD is complex PTSD, and the reason that they figured out that that's a different kind of PTSD is because it's complex, because with them, it's not this one incident, this car accident, this bomb that went off, 9/11 one day, like with me, or whatever. It's very complex because it was childhood related to all the small and big molestations, abuse, neglect, hunger, mom issues, dad issues, beat up, and then significant other and domestic violence, and then child, and then miscarriage, and like it just goes on and on and on and on until they're like 30 and they're sitting in your office going, I have trauma, and so you can't like slap PTSD, but you know that it falls under that umbrella. But how you're going to come at it is they're not going to relate to combat PTSD. They're not going to relate to cumulative PTSD, which is what the police have, because it shows up different and it presents differently, and the treatment has to be catered to that. But you have to know sort of like that's what they're at. So trauma is complicated in that way. One of the reasons I do it is just because, like I said, it's the cousins to depression and anxiety and dysphoria, where Lisa's sort of wheelhouse is a lot more specific, right, with the trauma.
And surprisingly, I don't have that many.
Really?
Right now, I have a lot anxiety and depression. That's
anxiety and depression, it is
kind of like
fucking flu and cold of the mental health world right now.
It really is. I mean, kind of like everybody has anxiety. Everybody's depressed. It's like, to the point where it's like, oh, okay, whew.
Yeah.
I can deal with this one.
Yeah.
Because you gotta gear up
Yeah.
for the other stuff. Like, okay,
Yeah.
here we go.
Very interesting. All right. So let's talk a little bit about, okay, so I don't know how long we've been talking. This might have to be a two-parter. So this might be this might be where JRoc has to like do the part two's coming. Part two is coming.
The sequel.
So what we're going to talk about the next time that we talk about this is we'll talk about the physiological factors, the identity factors, the LGBT community. I do want to talk about the men of color in particular, and specifically because what's alarming about the men of color is, and Latinos, you know, which is part of that umbrella, is the statistics that are specifically related to stress and trauma and racism and perceived or real discrimination and racial disparities and mental health and all of that stuff, and getting treatment and socioeconomic level and you name it is there, and how that shows up with men of color. So we'll talk about that a little bit more specifically next time, and men with disabilities and all the social and cultural stuff that patriarchy stuff, because like Ant said, the white community is sort of way ahead of the field when it comes to mental health and who got to go and all that kind of stuff. And the rest of us are like, we're too busy surviving. You guys go chit-chat over there. We're going to survive, you know, the civil rights and everything else first, and immigration and food and now we're catching up. So we'll talk a little bit about that. And then we'll talk about what the positive things are about it, what these common signs are that you see them struggling with: anger, irritability, aggressive behavior, drastic mood changes, appetite, misuse of alcohol and stuff like that. Just many things that, the big one, inexplicable aches and pains and somatic symptoms, which is a big one, right? We'll talk about that, and we'll also talk about what you can do and what is working and what is in their best, and how it needs to be culturally competent for you, because we're not going to tell you to go take a spa day or something if that's not your thing. Right. Like maybe you need to go run 10 maybe you need to go run 10 miles, and medication and why medication is important. And for some people it saves their lives, for other people it keeps them online, and for some people it's just temporary until they get back online. So we'll talk about all of that. There's a lot to talk about, too much for one thing. And then
this
really
is definitely a series.
It's a series, because we got to talk about depression. We're going to talk about anxiety. We're going to talk about substance use disorder and what's the difference between that and addiction, especially with men, because they're sort of encouraged more than we are, you know, to do that, and what all of that looks like. PTSD is a big one that we're going to talk about, because I think it's disproportionate with men.
Yes.
In terms of, you know, like with us, we tend to internalize a little bit more, and they just express it a little differently. Then there's bipolar and all that. So we'll get into that. Anyway, you guys, thank you so much for coming. I like this. I like to have more than because we have conversations about mental health. This isn't about one of us sitting here and yik-yakking about something, because we are. And I like that we have different perspectives, like Ant, and then we have JRoc's, and we have Lisa's, and we have mine, which is different perspectives on the reality of what we deal with every day. It's a hard subject. It's an important subject, and we will keep normalizing it so that men can feel like they can go, you know, find peace, man. Be happy. Enjoy your life. Right? Enjoy your life. All right, guys. So we're going to cut it here. Thanks for listening, and we'll see you next time, part 2.
The sequel.
Take care of your mental health, everyone. Thanks for listening to the X Podcast with me, Xiomara Sosa, clinical mental health counselor, licensed professional counselor here in South Carolina. We hope you enjoy our real conversations about all things related to mental health. You can check out our show notes for reference, resources, and other show-related information. If you found value in our conversation, we encourage you to join us weekly as we discuss different mental health topics. You can head over to the X Podcast website at www.studiotalkpodcast.net and send us a message from there, as well as sign up for our newsletter. Our email address is studiotalkmentalhealth@gmail.com. You can also subscribe to our podcast and leave us a rating and review at blueberry.com/studiotalkmentalhealth. And send us a text or call us at area code 843-695-9974. Please recommend our podcast to your friends, colleagues, family, and networks. Thanks for supporting us.